Club of Film School Enugu. We are here to educate you more on one of the world-known health problems, which is breast cancer. But firstly, BRCAN, which in full means Breast Cancer Association of Nigeria, is a not-for-profit, non-governmental and non-religious organization which has dedicated itself to galvanizing actions against breast cancer in Nigeria. BRCAN was founded in the year 1997 by Her Excellency Mrs. Betty Choma Anyanwu Akerutelu, the First Lady of Ondo State. She is a breast cancer survivor herself and has dedicated herself to fighting breast cancer through the power of action and advocacy. Since inception, BRCAN has organized many programs, which include BRCAN Fire, BRCAN Wellness Club, BRCAN Awareness Outreach, Job for Life, Hope Lodge, and lastly, World Cancer Day, which is on February 4th of every year. I would like to hand over to the anchor of the program.
Once again, you're welcome to BRCAN TV Awareness Show by Queen's student. The title of our wonderful program today is Breast Cancer. We shall start with the objectives of this program, which we're going to discuss about the meaning of breast cancer, the signs, the causes, where to detect breast cancer, and so many more. But before we're going to proceed into this wonderful show, I would love to introduce myself and my wonderful speakers here. I am Okuchukwu Ifoma, and here with me includes
Chukwuchinelo,
Ojiri Dabara,
Okwebu Sophia,
Mbezi Manuela,
Fuchizim, Chukwu Precious.
breast cancer was seen as a distant disease, but not anymore. It is right at our doorsteps. Please, BRCAN Deborah, could you please define for us breast cancer?
Breast cancer is a kind of cancer that develops from breast cells. Breast cancer usually starts in the inner lining of milk ducts or the lobules that supply them with milk. Breast cancer begins when cells begin to grow out of control, and these cells form a lump which can be seen on an X-ray or felt as a lump.
Indeed, breast cancer starts at the cellular level. But the question is, what are those things we see around our breast and we can say, yes, this is breast cancer? Please, BRCAN Precious, will you give us the signs of breast cancer?
Some signs of breast cancer include the following, which are lump or thickening of the breast or underarm area. 2. Swelling or scaling of the breast. 3. Redness of the breast, nipple discharge, and new pain in one spot for a long period. These symptoms are not necessary signs of breast cancer. So if you have these symptoms, go to the hospital to be sure.
Thank you for that. There was this story that I heard of a woman that put money inside her breast, and according to the story, it caused her breast cancer. She went to a native doctor. The man told her that it was a generational causes, 2 different causes. Which one shall we go with? But for more clarification, please, BRCAN Chisom, could you give us the causes of breast cancer?
Due to high level of ignorance, some people think that breast cancer is caused by putting money on their breast, spiritual attack, and generation causes. But according to research, the causes of breast cancer is not yet to be found.
Indeed, this is strange. But at least there should be some risk factors of breast cancer. Please, BRCAN Chinel, will you give us the risk factors of breast cancer?
The first and foremost risk factor of breast cancer is being a woman. This doesn't mean that men don't have breast cancer, but it is recorded mainly in women. The second one is age. From the ages of 21, the signs and symptoms of breast cancer begins to manifest, so you are advised to go to the hospital or get tested from the age of 21. The next one is family history. We find out that in some families, from generation to generation, they have these cases of breast cancer. So when you reach your turn, or if you find out that you are in such a family, you should better get tested. Thank you.
So are you trying to say that women have higher risk of breast cancer than men?
Yes.
What's the reason? Please, BRCAN Deborah, will give us an answer to that.
Women are at more risk to breast cancer than men because women have more breast cells and women menstruate.
This is strange. Okay, now how do we detect breast cancer? Like, what are those tests that we really have to undergo in order to detect breast cancer? Please, BRCAN Cheesy, will you give us the tests to detect breast cancer?
BSC is one of the tests to detect breast cancer and is breast self-examination. This is done by a person to know if he or she has the signs of breast cancer and can refer herself to the doctor immediately. If you are still menstruating, you can do your BSC immediately after menstruation when breast swelling and pain are minimal. But if you are no longer menstruating, you can pick a date maybe the first day of the month or the first Sunday of the month, the day you can remember for your BSE. CBE is another test to detect breast cancer, and that is clinical breast examination. This is done by a doctor or a nurse. Mammography is another test to detect breast cancer, and is an X-ray that can detect breast cancer before they are felt, and it is recommended for women who are age 40 and above.
She made mention of mammogram. Maybe it might not be clear to many of us. Please, Breckanite Cheta, will you throw more light on mammogram?
Mammogram is an X-ray of the breast that is done with a device that comprises and flattens the breast. A mammogram also helps a health professional to dictate whether the lump on the breast is a gland or a tumor. Thank you.
Let's go on a short break. We'll be right back. You're welcome back to this Breckan TV awareness show by Queen's Key students. We just talked about the test to detect breast cancer. Now we're going to talk about how breast cancer can be treated. Please, Breckan, Deborah, will you give us ways we can treat these diseases without a cause?
Patients with breast cancer have many treatment options, but these treatment options are adjusted specifically to the type of cancer and the staging group. The basic treatment modalities of breast cancer are diagnosis, chemotherapy, surgery, radiation, adjuvant therapy, and support system.
At least there are ways to treat these diseases. But here in Nigeria, we have some challenges we need to tackle them. Please, Breckan, I pray will you give us those challenges we Nigeria face when it comes to breast cancer and its treatment?
Some challenges which Nigerians face when it comes to breast cancer treatment in Nigeria includes the following, which are ignorance. Because of ignorance, some people might feel the signs of and symptoms of breast cancer on their breast, but they will conclude they are normal signs which are caused by weather or environmental change and do not take the right step of going to the hospital. 2. Customs and traditions. People believe that breast cancer is caused by juju or spiritual attack. Even when you try to convince them that it is medically treated, they will still believe in their religion or their custom. 3. Inadequate facilities. Governments do not provide adequate facilities for treatment of breast cancer. And last, with discrimination. People who suffer from breast cancer are stigmatized and are not accepted in society.
Indeed, discrimination is order of the day when it comes to early diseases. I'm very sure of that. I'm 100% sure of that in every diseases. Please, Breckanite Chisun, will you give us the 5 steps to be breast aware?
The 5 steps to be breast aware are: Know how your breast normally look and feel. Know what changes to check for. Look and feel for changes. Report any changes to a healthcare provider. Learn the benefits and limitations of getting a mammogram and make a decision of knowing what you are right for.
As individuals, how do we reduce breast cancer risks within our control? Please, Brecca Nightingale, will you give us an answer to that?
As an individual, we can reduce the risk of breast cancer by, firstly, eating balanced diet and good nutritional value. We are expected to eat more of the fruits and vegetables and less of fat. Get active, at least 30 minutes a day. We are meant to exercise our body to burn some fat. You drink 1 or less alcohol a day. Then, avoid smoking or exposure to secondhand smokes. Thank you.
We all have to put hand in order to eradicate breast cancer into society. Please, Brecca Knight Chizi, will you give us the roles of the individuals to help to eradicate breast cancer into society?
Individuals should have the knowledge and practice breast self-examination. One should join a breast cancer organization or support group. We can create an awareness program in our society, neighborhood, or in the church. We can provide emotional support to patients in the community through visitation and running errands.
My viewers, you have heard from the husband, so you have a role to play. Don't just sit at home, get active. But our government will not be an exception. Please, Brecca Nightingale, will you give us the roles of the government in order to help to eradicate breast cancer in the society?
Government should help in providing health care centers, in the sense that when an individual finds out he or she has any symptoms of this, in order for them to rush down to the health care center. Secondly, they should help to provide technologies and machineries such as mammography and radiotherapy. Thirdly, they should help in creating general awareness so that people over Nigeria could be aware of the disease breast cancer. Thank you.
We would like to leave you with this take-home message.
Every woman is at risk of breast cancer.
Breast cancer is not infectious.
Breast cancer is not caused by juju or spiritual attacks.
Breast cancer does not discriminate.
You cannot spray away breast cancer.
Ignorance is not an excuse. Get tested today.
Together we fight and defeat breast cancer.
Yes, we can.
I hope you learned a lot about breast cancer. The easiest way of fighting against breast cancer is being a member of Breccan Club. Membership is open to all individuals. For further inquiries, contact the number displayed on the screen or visit www.breccan.org.